Good day, I'm Andrea Pradillada from BSN 3D and I'm going to perform the Administering Oxygen by Nasal Cannula. Administering oxygen by nasal cannula. For the goal, the patient exhibits an oxygen saturation level within acceptable parameters. For the equipment, we need to check for oxygen delivery devices as ordered by healthcare provider. Oxygen tubing, consider extension tubing. A humidifier if indicated. Sterile water for humidifier. Oxygen source. Oxygen flow meter and appropriate room signs. For the implementation, number 1, we need to bring necessary equipment to the bedside, stand or overbed table. Number 2, we need to perform hand hygiene and put on PPE if indicated. And then next, we need to identify the patient. Next, we need to close curtains around bed and close the door to the room if possible. Number 5, we need to explain what you are going to do and the reason for doing it to the patient. Sir, I'm going to perform on attaching the nasal cannula for it to help you to breathe easier. We need to review safety precautions necessary when oxygen is in use and place no smoking signs in appropriate areas. Number 6, we need to connect nasal cannula to oxygen setup with humidification. If one is in use, adjust flow rate as ordered. Check that oxygen is flowing out of prongs. Next, we need to place prongs in patient nostrils. Place tubing over and behind each ear with adjuster comfortably under chin. Alternately, the tubing may be placed around the patient's head with the adjuster at the back or base of the head. Place a gauge at ear beneath the tubing as necessary. We need to adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. Next, we need to encourage patient to breathe through the nose with mouth closed. Sir, please breathe through your nose and close your mouth. And then next, we need to reassess patient's respiratory status, including respiratory rate, effort, and lung sounds. Note any signs of respiratory distress, such as tachypnea, nasal flaring, use of accessory muscles, or dyspnea. Next, we need to remove PPE if used, perform hand hygiene. And next, we need to document. Next, we need to put on a clean gloves. Remove and clean the cannula and assess smears at least every 8 hours or accordingly to agency recommendation. And next, we need to check smears for evidence or irritation or bleeding.